Hey everybody, this is Dr. Don. Going to talk a little bit about RSV. RSV is respiratory syncytial virus, and this is a viral infection for which there is no specific treatment that causes respiratory illness in children and adults. We used to think this was only about children, and it tends to cause bronchospasm and wheezing and cough and sometimes some fever. In children in particular, and talking about children like less than 2 years of age, this can cause hospital admission and occasionally respiratory failure. And there's no specific effective treatment other than treating how you would treat asthmatic bronchitis in general, steroids, bronchodilators, and letting the virus run its course. In other words, there's no antibiotic really proven to be effective against RSV infection. We used to think this didn't really affect adults, but we never really tested for adults until the last 15, 20 years or so when we found out it was a significant cause of disease in adults. Right now, it's estimated that around 110,000 people per year in the U.S. are hospitalized as a result of RSV infection. Now, of course, these are people that are actually tested. Many people come to the hospital with wheezing and never get tested for what virus they may have, particularly since there's no particular treatment. But this is the CDC's estimate of how many infections there are. Maybe it's high, maybe it's low, who knows. In any case, of those people admitted to the hospital for RSV, and this again assumes that there weren't RSV positive admitted for some other issue like heart failure, for example, of those people that are admitted, about 10% die. So in the United States, there are between 6,000 and 10,000 deaths per year from RSV. So that certainly sounds pretty significant in the scheme of things. And again, this is in people that are largely over the age of 65 years of age. So what is that actual risk of RSV disease? Obviously, if you have a cold, you have a cold and you're not admitted to the hospital, and maybe that's not such a serious thing. It's a nuisance. You might miss some work. You might have to take bronchodilators or steroids. But if you're not so sick that you wind up in the hospital, there are lots of viral infections that can cause wheezing and cough and low-grade fever that you just sort of get over and you fight them off. So how many adults are there in the United States over 65? Probably the easiest way to look at it is how many people are on Medicare. Now, Medicare, you qualify for this when you turn 65, and there are people that are totally disabled for other reasons, such as renal failure, for example, that also qualify for Medicare. But the vast majority of people on Medicare are people that are over age 65. And it turns out in the United States, there are approximately 65 million people in the U.S. that are age 65 and older. And this is the age group that the CDC says should at least consider getting the RSV vaccine. So the absolute risk, then, if there's 65 million people and 110,000 of them are going to be admitted to the hospital, that means that roughly 1 to 2 people per 1,000 that are over age 65. So if you do the math, that works out to about 1 or 2 hospital admissions per year for every 1,000 people age 65 or older in the United States. So it's not a high risk, but it's not zero. So 1 in 1,000, 2 in 1,000 per year will be admitted to the hospital. Of those, about 10% will die. So that's about 1 to 2 per 10,000 people in a given year will die of RSV infection. So how good is the vaccine? Well, the drug companies, of course, test these things. They'll have 10,000, 20,000 people get the vaccine, compare how they do compared to the same number of similar people that don't get the vaccine, that get a placebo, for example. And it turns out that the effectiveness at preventing severe disease, meaning hospitalization, is about 94% for the GSK vaccine. It's a little more complicated for the Pfizer, but similar. If you just assume 90, 95% effectiveness at preventing hospitalization, that sounds really good when you hear that 95%. But there's more to it than just the relative risk reduction and how effective it is at reducing the risk of infection when you're deciding whether you should get the vaccine or not, because you have to consider the total risk. Because if you don't get the vaccine, there's a 99.9% chance you will not get RSV bad enough to require hospitalization. So even though the vaccine is 94% effective at preventing hospitalization, doing nothing is pretty darn effective as well. So that has to be taken into account when you consider the benefits versus the risk of taking any vaccine. And these numbers are different for every vaccine, and they're not different for every illness. Another way I like to look at the statistics on these vaccines is how many people would you have to vaccinate to achieve the goal of preventing hospitalization. It turns out for the vaccine for RSV that you have to vaccinate approximately 750 people over age 65 to prevent a single hospitalization. And since the death rate is about 10% of those admitted, you have to vaccinate about 7,000 people to prevent a single death from RSV. So the shot works, it's 94% effective, but that's an awful lot of vaccinations for preventing a hospitalization or especially preventing death from RSV. And because the overall risk from RSV hospitalization and the overall risk of RSV death is very, very low, the vaccine needs to be that much safer to be worth the risk. And I don't really have any special insight that the RSV is dangerous by any means, but there are some patients that get the RSV vaccine that seem to get Guillain-Barré syndrome, which is a neurological disease, usually reversible, but not always, occasionally fatal, that can lead to respiratory failure and need for mechanical ventilation, much as previous flu shots have been implicated in this. But people that get the vaccine have a higher rate of Guillain-Barré than people that don't get the vaccine. It's a very low risk. There were only 2 or 3 people in the clinical trials that developed this syndrome. But again, when the risk of the disease being prevented is low, that makes the relatively small risk of a side effect a bigger deal than it would be otherwise. This may be one reason why the CDC came out and said this should be a shared decision between the patient and the doctor as to who should get vaccinated. They don't recommend that 100% of people in any particular group get the vaccine, but it depends on your degree of fear. If you fear the vaccine more than you fear the disease, maybe you shouldn't get it. If you fear the disease more than the vaccine, maybe you should. Only about 10% of eligible people have decided to receive the vaccine, and this concerns, of course, the people that sell the vaccine, but also the CDC, because they have to assume there are some high-risk individuals that probably should have gotten the vaccine. So who is high risk? Well, the older you are, the higher the risk. If you have lung disease where a case of asthmatic bronchitis caused by the RSV could be more likely to be life-threatening, then of course you should consider the vaccine, because your individual risk of death is probably much higher than that of the general population of healthy people that are over age 65. If you have immune compromise, you might be at higher risk of getting serious disease and should consider this. And this would include cancer patients, patients on chronic steroids, people that are receiving chemotherapy, people that have HIV or other illnesses that affect the immune system, all are at higher risk. But I just wanted to show that the top line statistics that are used in promotional marketing don't always tell the whole story. And that while the vaccine seems to be very effective at 95%, when the disease itself is pretty low risk and the risk of death from the disease is pretty low, given the size of the population at risk, that has to be taken into account. Most people that I know that are my peers are not getting the vaccine, but if they have high risk illnesses, maybe they will. And I'm not saying it's a bad thing to do is to get this vaccine, but take into account the overall risk of the illness when considering whether the vaccine is right for you. If you have further questions, leave them in the comments below. Don't forget to subscribe to the channel, share the video with people that are considering the RSV vaccine or that might be interested in this content. Until next time, see you later.